Welcome, Dr. David. It's great to have you participating again on the webinar series. And what do you have for us today?
Hi, Tammy. It's great to be back again. Always appreciate it, and always fun to spend time with you. Well, Psycho Bunny and I are here today talking. I still am always interested to talk about the new book, Sex Under the Influence, which is really one of the first books to really pull together this what we call chemsex, or sexualized drug use is the proper term these days, but really how it's combined factor for a lot of sex and porn addicts. And we are seeing this increasingly. I know at Seeking Integrity, just the number of guys who are coming in, and people have always used drugs to some extent, but this, when we talk about chemsex per se, or sexualized drug use, it's when those two things, the drugs and the sex, have become so wound up together and fused and integrated into one addictive ritual. That's when we're starting to see this explosion. And so we're seeing all the behaviors that go with that. So a lot of heterosexual guys, for example, coming in, and they've gotten involved with cocaine and methamphetamine, and part of their sex and porn acting out process, and suddenly their sexual escapades have extended beyond all kinds of to men, to transgender folks, to all kinds of different behaviors they haven't done before. Just those drugs seem to light that sex addiction behavior on fire. And I think it's something that a lot of people who may not have think they would have to deal with chemsex, they're starting to see it. So I think I always want to point out that it's there, and we're seeing a great uptick in the last couple of years. More and more of our traditional sex addiction clients are coming in and presenting with these additional kind of add-on amphetamine behaviors.
One of the things I am finding a lot, and this has been traditional too, is many people go off to substance programs perceiving that if they stop the substances, everything will be all better. And I give them credit when they're reaching out going, I need help, because it's like, oh my gosh, I already tried treatment, And so, but I think there's so much misinformation out there. There's a lack of knowledge by many professionals of the co-occurring. And so, it's so different with substances. If it's just abstinence, it's just not doing the problematic, substances, but it's not really addressing the underlying issues. And so, like you're saying, it's like, people are using all kinds of other things, where at Seeking Integrity, we're really looking holistically at addressing, we're paying attention to, to any of the problematic and compulsive behaviors, because then you can address the underlying issues so they aren't just switching to another form of acting out or relapsing. But it's a problem within the professional community, but from substances.
A huge problem. And from substance abuse providers who do great work with the drug side of it, right? And they're famous, household names, and they have a lot of very highly trained clinicians. The problem is there's kind of some blind spots there, and I think part of it is the training. When we get is so focused, this substance abuse training for a clinician is so kind of siloed and very different from behavioral or sex addiction particularly, and even mental health. And so people have as a mentor of mine once said, people find what they're looking for, right? And if I'm trained to look for substance abuse stuff, I may have blind spots around recognizing the sex and porn addiction issues, which are huge right now. I'm in recovery myself. I go to my AA meetings, and just hearing the talk and seeing what people are doing, a lot of them are just have really transferred addictions right into the sex and porn stuff. Is just incredibly common. So I think we do people a disservice. And the other thing I hear clients say all the time is that my therapist told me if I just get clean and sober, the sexual stuff will take care of itself. Well, no, it won't. We know that it's a burning, addiction that's alive and well, and we have to treat it as such. And it's complicated because it's two different, as you just said, two different recovery strategies, right? If somebody is a substance user, by the time at least they come to us, there's such a thing as harm reduction, but people that find their way to me have well past harm reduction, and they really need an abstinence model, but that's not the model for the sex side. And so a lot of the traditional substance abuse programs have no idea. I do a chemsex support group for Seeking Integrity, on Tuesday night. Last night we had this conversation with people just having no idea of tools like a circle plan or the 3-second rule, or even dealing with fantasy. These are really essential tools for somebody who is experiencing that chemsex fusion, but traditional rehab, traditional therapists even don't really provide that. It's a big gap, and our clients are suffering because of it.
Yeah, well, and I find that many mental health professionals have limited training in addiction overall, and so, and what limited there is usually on substances, which is harm reduction or abstinence based, but and they're not paying attention, like we're paying attention even to gaming and and food and every like there's so many different ways that we as addicts can choose to act out, and like the probably there are very few that are completely abstinence, I would say, like gaming or smoking, obviously, which I guess would be a substance too, but porn, and there are some that could be absolutely abstinence, but food, that's not realistic. So
Exactly. And even I'll say, then, to Seek Integrity's credit, right? We ask clients to give up nicotine, and I think that's extremely rare in a lot of treatment centers, where that nicotine is the one very powerful drug that people hang on to. Now, in the scheme of things, it may not be as devastating as meth in the moment, but it sure is, in the long run, causes a lot of problems as well. And it keeps that brain, as we've talked about, keeps the brain really primed for addiction. It never really kind of turns off in that addicted part of the brain. So when you're having nicotine on a regular basis, so it's a powerful drug.
Yeah, and I see that gaming. I mean, like so many people are using, it's just another form, but it's the intensity, it's the escape, it's all of those things. So whether it's smoking or or vaping, or it's gaming, or non-porn or whatever it is, it's keeping that intensity, but it's keeping people disconnected. They're disconnected from other people. They're not doing the attachment work. They're not doing the healing work. And to use 12-step language, we're not happy, joyous, and free if we are still hanging on to, something that's keeping us, in active addiction.
Addiction is really, it's our maladaptive coping mechanism, right? And we're going to hang on to it until the bitter end. I, as an addict, certainly was reluctant to finally face the music and really start to feel feelings and do the work. And I think if there's an outlet that is perceived as less harmful or okay, or even endorsed by a lot of other peers in recovery, it can be a real problem. That peer pressure thing can be adamant, I think, to keep people stuck and not feeling and not progressing and wondering why. A lot of people I see that have some months in program and are actually abstinent from a drug, but they're not still they're uncertain why they're having trouble in their relationship, why they are feeling better, why they're still feeling depressed, or kind of always on the edge of relapse for their substance, because they have this active addiction going on in their lives that really is unrecognized and really needs to be addressed, for sure.
Yeah, and it's challenging. I mean, like you said, when you're looking for something, and that happens even with CSAT trained therapists, sometimes there is a perception that something is sex addiction, which isn't. So it really does take somebody who's open to looking at all things and not just, digging in on a lens of like, well, you are, a sex addict or whatever. I mean, a lot of it is. But there are a lot of nuances with things as well. So I think it's key to have, a highly qualified professional helping, guide the process. I think if you're feeling like things are stuck, there's another, like, and it isn't 5 minutes into, like, I've been absent for 5 minutes. So now, like, why aren't things getting all better? But like, if, like you said, if you're doing the work and attending the meetings and working the steps and working with a sponsor and things like that, and, working with a qualified professional and things are not moving forward, then I think it's fair to go, what more do I need? And we get guys, that have been trying, and I give them credit for, like, I've been going to meetings. I have been, doing these things, but kind of on that, and Scott has done a great job on a webinar before on, the cycle of addiction. And it's like, well, okay, it's almost like the pressure cooker of like, okay, I can hang in there for, whatever period of time, 30 days, 60, whatever. And then I relapse. And then it's like, okay, and then I'm digging in, I'm doing all the work again. And then it just keeps happening over and over again. And like you said, it's a maladaptive coping mechanism. So, doing a more, doing work from a more level up and going, let's look at all of these things and these different patterns and what's going on. We've got, I'm going to put a plug in, we've got the attachment wound and inner child work groups, and if you've got some level of recovery, those are great, great opportunities to dig in, and work on some of those underlying issues. How we make progress, with this stuff is that we show up and are willing to, to dig into the things that we've been avoiding for decades.
No, it's true. Absolutely. And I think a lot of the original work with chemsex was with gay men, of course, and it's expanded much beyond that now. But I often talked about those guys once they got in recovery as having to come out for a second time, because they may be in their 50s or 60s and thought they put all that stuff, they dealt with all that 30 years ago, but they dealt with it with alcohol and drugs. They kind of just numbed their own internalized homophobia or their body shame or their embarrassment about certain sexual stuff or whatever it was. And now in sobriety, when they're really facing all that really for the first time in their lives without any substance or mood altering behavior on board, then they really have to start feeling that and face it. And so there's a lot of work to be done. And there's a lot of pitfalls for somebody in recovery. With sexualized drug use or chemsex, one of the patterns we see are people, bottom out, get into recovery, and they're sober from the drug and they're sober from sex. And as soon as they try to integrate some kind of sex back in, they relapse on the drug. And that kind of bouncing on the bottom is really discouraging for everybody, but especially the addict. And until we start to deal with some of these other issues, right, as you say, that have been here forever. And then you can't do all that at once either. This is long-term work. But we have to also, I think it's incumbent on us as clinicians to make sure, if we look at addiction as a maladaptive coping mechanism, we sure as heck better provide them with other ways, other skills, other tools to do that, because we've taken their primary one away. And so a lot of those skills to stay sober, how to get connected, how to stay connected, how to talk about feelings, all that stuff that really needs to be done to make sure that people just don't fall into a pattern of bouncing on the bottom, or worse, with a lot of sometimes the response with sexualized drug use or chemsex is this sexual anorexia. People just say, well, every time I think about sex or try to engage in sex, I relapse, so I'm just not going to go there. And it's based on fear. And that's not a good strategy for recovery either, right? Because they end up kind of white knuckling it, sometimes for years, and then they relapse it anyway, oftentimes. So helping our clients understand these skills and learn them often for the first time is really critical, really critical.
And I think you're right, but I think there's hope in that you can learn these skills. Like it doesn't have to be, like, oh, I'm going to chronically relapse. I'm going to, I'm forever going to be struggling with this. No. And it doesn't have to be, I can never be in a relationship because that, that's a, that's a source of problems for me. Well, yes, but honestly, I share often, Dr. Rob and Dr. Stantak, and we do in a healthy relationship. That podcast was January of 2019. But in a healthy relationship, we are better off. We are healthier. We are happier. Like all of these good things happen. So we are like, we almost are saying, I'm not even going to try for that level of happiness because I might relapse. And, I think what you're saying is, let's make sure that you have the support so you can try this baby steps, and have the support so you don't have to relapse. You won't do it perfectly. Nobody does a relationship perfectly,
Exactly.
but you can go, okay, like I'm thinking about relapsing, or I'm the way I'm finding people, I'm meeting them in, problematic places, so I think that there's lots of skill building that needs to happen in order to change.
Absolutely. And I think that I'm a big fan of DBT, dialectical behavioral therapy, with all those toolkits they have, but it's the way we frame it. I think that recovery process of helping our clients see these needs, see the bigger deficits and the longer pattern, and of course there's trauma in there too, and the time they are to form of when do we start to do trauma therapy before we overwhelm that client's coping skills, and I've seen a lot of people relapse from well-meaning therapists starting trauma too soon, trauma work. So there's a whole bunch of moving parts here, but I think the bottom line is that, yeah, we have to help our clients keep moving forward and not fall into that kind of frozen place of fear or numbing or avoiding. Addiction is all about avoiding anyway, and that if we just continue to avoid certain parts of themselves and deprive themselves really of the joy of intimate connection, and that's a normal and healthy part of life. And I think a lot of our clients, at least initially, don't know how to do that, and that's where they are and where they should be, right? And we can help them with that.
Yeah, well, and addiction is so isolating. Like, even if you're in a crowd, you're still all alone, and so yes, it's terrifying, especially when you remove all of the problematic behaviors and acting out, the things that help us cope, our maladaptive coping mechanisms. It is scary, but and I hate, because I do hear people that settle for the "I'm never going to change. This is as good as it's ever going to be," rather than going like, "I'm willing to try." And I don't know how, as a mental health professional, you start to shift that to go, yeah, like, no, trust me, you too can be, like, just, again, baby steps. Like, can we move the dial a little bit? Okay, you did that. And, can we do it again? Because settling, like, for me, recovery, it's still life, but gosh, there's so much joy in it and good things. And I hate when people, A, don't get it, like they just choose to stay in active addiction, or B, settle for, like it's kind of like just, the dry drunk, I'm not really in recovery, but I'm not acting out, just abstinence.
Yeah. I think one really nice way to do that is just to really focus on those relationships in early recovery, right? And with peers. I'm often struck at the guys that come through Seek Integrity in the House talk about, really developing intimacy skills with each other, right? And by that I mean they're willing to be vulnerable in group and talk about stuff, often things they've never said to anybody before. And we often say those guys know each other better than probably anybody else in their lives. But that ability to start to learn how to trust, to learn to practice with being vulnerable, to practice listening, and I don't know. So these are all life skills, right? They're intimacy skills that are directly, translatable to their primary relationships outside. But I think that all that early recovery stuff that we almost take for granted in the process is really wonderful skill building of the kinds of things we're talking about, of identifying feelings and practicing being hurt or disappointment or being angry, and how to handle that in a healthy way. And all those can be done in that context of early recovery, and that I think really builds those skills that are directly transferable. And the other thing, just to highlight what you said, and it's so true, is that if I maybe changing strategies, right? If I'm desperate to be in a relationship, going on hookup sites may not be the best way to do that, right? But that's all I've ever done. That's all I know. So really kind of getting out of our comfort zone and helping our clients get out of our comfort zone, and going dating plan or coffee or whatever, just to break that cycle and to try new things. And in my experience with clients, at least when they can do that, there's a lot of fear, but if they can try it, even if it doesn't go well, they've tried, there's a huge boost that goes with that. I think is, first of all, it's a big dopamine hit, which is good for any addict, but also I think it's really useful for them to see, hey, I can do something different, and I can learn new tricks and how to get the rewards that go with that. It's pretty exciting, actually.
Yeah, well, and it's always sad to me when people let fear paralyze them, and I feel like, and maybe I'm wrong, but I feel like it is a because like, like it's the facing our fears. I was talking to somebody the other day, and I was like, no one has died of, fear of whatever. I can't remember what the situation was, but I was like, I don't know anybody who has died of, being afraid to walk into a 12-step meeting, and, like whatever it was, and so, so yeah, like, I've stood outside of a 12-step meeting and I had to take a deep breath and go, okay, I can do this, and give myself a little pep talk. Or better yet, you have somebody, that's going with you,
Right.
so I mean, there's so many strategies to overcome that fear. Being in a difficult conversation with somebody, like, again, like, you can't repair a relationship if you're not, communicating. If you're just, turning around and escaping again, you're always disconnecting. So yeah, it's scary to go, like, I need to have a difficult conversation with you. Are you open to having it? But gosh, okay, I am. And that means, okay, we're in a relationship and we're willing to, to connect. That, Dr. Rob on Monday night's webinar looked up a list, because people automatically use the term intimacy for sex, and I go, lots of
Right.
sex addicts can for sure show you that sex is not intimate. It's objectifying. It's and whatever, thrill seeking dopamine. And he looked up the top 15 words. Not one of them had anything, it wasn't sex. It was vulnerable, it was connection. It was like all of these other words. None of them were about sex. Now, those all would be part of how to create intimacy, so that, you can be in a sexual relationship with somebody in an intimate way, but that disconnect of, like, if I'm sexual, then I'm intimate. Nope, not necessarily.
Right. The other one I often see the sex and porn addicts often doing, and chem sex addicts for that, the amphetamine folks as well, that intimacy equals intensity, right? If it's
Yes.
intense, then that must be intimate. And of course, intimacy can be intense, but it certainly has a lot of other, flavors as well, right? And in terms of just being soft or tender or quiet or whatever, but it's just not always intense. And I think that's kind of the becomes the hallmark of what intimacy means, or for the addict at least, as a mistaken belief for the addict
Well, and
themselves.
it's got to be difficult as a professional to help clients understand, if intensity is always good, so to speak, to go, this is going to feel different. It's not going to feel the same. And this ultimately will be better, but you're not going to feel the same. So, thoughts on, and we'd welcome questions. Honestly, we're chatting about things, but we would really welcome your questions. But your thoughts on how you help somebody mentally make that step from intensity to, okay, feels boring, but I'm learning to connect.
Yeah, and part of it is kind of asking people to kind of take a risk, right, and make a jump and be open to trying new things. And I think a lot of what happens if they aren't feeling that intensity, which goes with a lot of adrenaline, it's that whole fight or flight stuff. We're not feeling much feeling at that level when they're in that state. But when we're in a quieter place and trying to be intimate, it can be, of course, a lot of feelings come up, often fear or feeling not good about yourself. All the critical core beliefs about ourselves often come up in those moments, and all that kind of starts to swim around our head. So helping people recognize that, I like to really anchor it in somatic kinds of work. So breathing, I think breathing is a great way to just kind of relax and ground oneself. And even I'm a sex therapist also, and just helping people connect when they're uncomfortable is often, it starts with breathing. Just let's get everybody calmed down and grounded. And it's a way of getting in touch with their bodies and relaxing at the same time. I think there's different skills. We were talking about skills and techniques before. I think it's just a lot of skills, and most of all, the willingness of the client to be a little uncomfortable and try something different, and see what happens. And the thing about with any kind of intimacy or sexual behaviors or anything in recovery, it's often going to be different. Like you say, it may come off as boring. It's going to be uncomfortable. It's going to be awkward. All those things. I kind of help people talk through in advance what to expect, right? Because and don't let that hold you up or break the process when you're in it. One thing I like to do, spend around forever, is the sensate focus exercise of Masters and Johnson, which is a kind of a built-in protocol that people are focusing on, doing something, either receiving or giving, and that is a nice way to connect as well, and kind of lay down different patterns of practicing this stuff that is not necessarily intense or going for kind of the objectification of someone, but really, really connecting at a deeper level with a human being, and listening and giving back as a give and take, which is a nice interaction as well.
I shared Sensate Focus Touch with someone yesterday. It was appropriate for where they were in a relationship, and I love the mindfulness. I think breathing exercises, grounding, all of those things are really important. I still think it's got to be a bit of a hard sell for an addict who's going like, yeah, but I like the adrenaline and all of this kind of stuff, to go, okay, you're going to be connected, but it's going to be a little boring, and so but I know for sure, because I've experienced it, like, yeah, if I'm willing to try, like, the rewards are so much better than the intensity, and feeling always alone.
And I think, every addict goes through moments when they're teachable and then they close up, right? I think so. Timing for the message is also important. You get somebody when they're just frustrated, and they're disappointed, they're discouraged, and it's not working, or they're dissatisfied, whatever it is that makes them kind of want to, motivated to change somehow, and maybe be willing to try something a little uncomfortable or a little awkward or a little unfamiliar. But you're right, it's not necessarily an easy sell if they automatically assume, if I'm not feeling revved up, emotionally and physically, it's not the experience I'm looking for. Well, that framework has to change. Now, actually, it's interesting because I worked mostly with methamphetamine users for 30 years, and methamphetamine dumps out about 13 times the amount of dopamine as normal walking around dopamine in normal sex without a drug. The sex and porn are somewhere in the mid-range, so they also bump out a bunch of dopamine, but not like the meth dump of dopamine. And so that the extreme nature of it makes it kind of easy to see. It's like, yeah, that's kind of that's become sort of the gold standard, right? But it's unsustainable. It causes problems. It has terrible consequences. You're suicidally depressed afterwards. I mean, it's almost easy to point out the downside of that intensity. It's just not working for people. And certainly, I think if sex and porn addicts are willing to see it, they can notice the same things in themselves. It's not working anymore, and there's a lot more that they could be going for besides just the adrenaline.
You've shared with meth users in particular that it burns up the dopamine receptors too. So at some point, you're chasing, but you're not getting what you were before, correct?
That's right. Meth is really the only drug that's neurotoxic. So when it rolls off that dopamine receptor, that receptor's dead or dying. And so they're basically wiping out the transporter system that inhibits the brain's ability to distribute dopamine anyway. And then combine that with a process that we also see with sex and porn addiction, where we call it dopamine downregulation, where the brain is also getting rid of some of its receptors just to cut down the amount of dopamine in the system. That's a compounded process that suddenly you get into recovery and you're really starved for dopamine, because the brain has already adapted to this lot of intensity all the time. So if we cut off the music, if you will, as it goes silent, all of a sudden, the brain doesn't know quite what to do with it. And we can really drop into depression and anhedonia that we see with sex and porn addiction, where everything seems gray and blah, and even stuff not related to sex. Like food doesn't taste as good and colors aren't as bright. And that's a temporary state, but it's one that's unnerving for sure for a lot of intensity addicts in early recovery.
So, like, if a receptor is dying or dead, like, you're not going to get that one back. It's just you have an opportunity to get new ones, or how does that work?
Yeah, so they do regenerate, and that's the good news here.
Good.
The most extreme cases I mentioned are methamphetamine users, and that can take up, we know from solid research, that can take up to 24 months for those to get back to sort of normal. Now, I've had a lot of clients who, after 12 months, felt and appeared to be normal, right? So I think if we probably would have run scans on their brains, we could see that they were deficient in dopamine receptors, but they would never know it. So that 24 months is a little bit misleading because I think 12, from a client point of view, 12 months is probably where they start to feel normal. For example, I've had clients say, I could read a book, I could focus after about a year, and I couldn't at all before, that kind of thing. So the good news is that they do regenerate. In younger people, they regenerate faster.
Of course.
Just makes sense, right? Exactly. And we also know that exercise can be beneficial in speeding up that process because it throws off a lot of amino acids that are the building blocks of that system. Now, the downside, of course, is that we're dealing with compulsive people, and exercise can really be also kind of addictive. And so we got to watch that. But the good news, it does come back, but it comes back slowly. Those are not quickly generating nerve bundles. So we have to have a lot of patience about that process.
Yeah, well, and I get that it's got to be super hard in that, in that process to feel I'm depressed. I wasn't feeling depressed, when I was acting out before, and it's easy for us addicts to forget and then when you're not acting out and you're in the aftermath, you are depressed. But I mean, it's just challenging. The addict brain is such a, I mean, like denial, lying to ourselves first, like we start like, oh yeah, like I can do it differently, or I'll do less, or whatever it is that we perceive that we, can do to not have it feel the same as it does right now. So,
I think there's a interesting parallel here that a lot of research is going on with methamphetamine recovery right now. And a lot of the programs, because of this big dip of anhedonia and really clinical depression, really, in early recovery for meth users, a lot of the strategies are doing what's called behavioral activation, which is just a way of really putting the focus on things that alternative sources of dopamine. And in our terms, it would be outer circle behaviors, right?
Yeah.
And I think it's really a nice reminder for if somebody even doesn't have any amphetamine involvement in early recovery to really focus, to emphasize, whatever that might be in the outer circle, just in terms of getting dopamine, getting connected, and recreation, listening to good music, or whatever, petting your dog, whatever gives the dopamine hit is useful to really focus on that. And that's, as I say, with methamphetamine, that's really made a difference in some of the relapse rates. And I think it would be probably more subtle, perhaps, with sex and porn addicts, but equally useful to remember.
Oh yeah, I often say, and your outer circle is not just, 12-step meetings and talking to your spouse. I mean, it's got to be life. It's the good stuff in life, like all of those things that you shared. Like what brings us joy, what brings us, some contentment. What can we be intentional about that are the good things that when we're in active addiction we're completely missing because we're so completely focused on just acting out and the next acting out, planning ahead. So, Dr. David, we've got some questions. So you mentioned there are moments when an addict is teachable. How do we recognize those moments as partners or friends? And what should we do to help in those moments? If I suspect a friend or acquaintance has a sex addiction, how can I help them? Great question. Thanks for asking that.
Yeah, it is a wonderful question. I think where I see that teachable moment mostly occurring is at that part of the addiction cycle after somebody's acted out, when they're in that remorse phase, the shame, oh my God, I can't believe I've done this again. That's the one segment of that whole addictive cycle where they're in a different mindset, where they're open to it, and it's a small window that closes too. And sometimes it closes fairly quickly. So when people start to feel better again, and that may be just a matter of days, but I think really watching for that and recognizing the pattern. Hopefully sometimes you don't have to wait for an acting out incident to occur and then the follow-up after that. But that's when I see it most of all, when people, the kind of fever has broken temporarily and people have realized they come to their senses a little bit and realize, oh my God, what have I done? And that's when they're motivated to make some kind of change. And I think that's the moment when we as professionals kind of have to step in, and then because that'll close again, right? And then we have to deal with, hopefully we've engaged them enough that they're kind of part of the process at that point. We can get them through the next hurdles. But I think to just listen is the other way to know what are people saying in terms of when they're reflective, when they're thinking about consequences to their own lives or lives of somebody they love. I mean, when they're kind of reflective about that sort of thing, I think is a really good indicator that they might be receptive to some kind of talk about seeing patterns. And the addict mind is so clever at kind of clouding and these layers of denial and just gaslighting. And I think addicts gaslight not only partners and friends, but themselves too. And to some extent, I think addicts believe their own stuff sometimes. And so I think just really, there are moments when that becomes a little bit of clarity about what my life situation is. And those are the moments where we have to jump on it. Because they, as I say, they close quite quickly. But usually, as I say, it's after an acting out phase before they sort of get their footing again and sort of the addictive process starts all over again. But it can also happen along the way with certain life intervenes. People may lose a job, or there's a breakup or a car accident, or, there's all kinds of moments when that can also create this moment of clarity, at least for a moment, to see and how people can make changes at that point.
I agree with you with the window closing, pretty rapidly. There's a number of people right now that have reached out about treatment, and I'm reaching out to them and they're radio silent, and I hate that. As someone who knows how devastating this disease is, when they're radio silent, I'm going like, I'm sure they're full into active addiction. It's challenging because I talk about this being life changing, and it is. Recovery is life changing, and addicts who don't want their life to change, they want the negative consequences to go away. But I don't really want to change things. I got a few problems right now. And that's a difficult thing. On our homepage of Seeking Integrity website, you'll see quick self-assessments. There's two of them. One is for sex and porn addiction, and the other is with co-occurring substances. It's 25 questions. It is not the same as what we use for the clients coming into our residential program. That's, much more extensive, but it's a good self-assessment. And, there's, you count the number of yeses. You can email me, with the scores, because that kind of helps gauge what level of help would be appropriate and optimal for helping somebody. For example, I often say if somebody scores a 5, that's very different than if they score a 15 and the level of help that would be necessary. But I do agree, I was one of those that was already going, oh, that was really bad, and I won't do that again. And I would have. Fortunately, I had loved ones in my life that were like, yeah, no. And, and someone was like, get her to treatment. And they did, and thank goodness I would not have had, I would have not had the skills. I would have stopped. Like I had no intention of, I realized one aspect was a problem. The rest of it I was thinking was fine, and so all of that denial and that game playing, all of those things, we get so many guys, and this too, Dr. David, that come to our program and just like you're talking about, those really negative consequences. I've lost a job. I've lost a spouse. I've lost a family. And had they come 6 months before, it probably could have been different, in that moment. So unfortunately, as addicts, we too often wait till, like you were talking earlier too about the, hitting the bottoms and keep, doing it, and for many of us, we are way down there, and I always think how much better, I love it. We get some guys that are in their 20s, and I'm like, hallelujah. I mean, we've had guys in their 80s too. So trust me, we welcome everyone. But, if you're in your 20s and you can start to change things and you can do life differently, that's a gift. And, and we want to celebrate that. You don't have to wait till you've, ruined, family, kids, and, whatever. You can get help and be on a different path. And the addict brain is still going to go, but wait, I'm missing out on this excitement.
Exactly. I so agree. I got sober when I was in my 20s. And one of the differences with this guy, he turned out to be my first sponsor, but he said, really what you have to realize is that you're on an elevator going down, and you can get off at the 30th floor or the 20th floor or the lobby or the sub basement, but it's only going one direction, and that kind of really helped break through. It's like, I'm too young for this. I mean, I this
Yes.
is not, but I realized the trend was clear, and okay, how much wreckage is it going to do once I realized I'm on a path? And fortunately, I had the support to be able to get off the elevator at a lower floor without the basement. So yeah, it was just a matter of realizing this is what's happening, and we don't have to ride it all the way down till we crash.
Yeah,
So yeah,
and you and I both were fortunate, that we got the help that we needed at a young age, and we chose then to continue to do the work. I still go to my 12-step meetings, and it's one of those things where, I recognize what a gift I have in recovery, and so I don't want to do anything to jeopardize that. Do I think I'll act out? Pretty good chance that I won't, but like, who wants to play that game, And I
right,
just am
right.
happier if I'm, it's like, yeah, I stay on the beam. My life is more serene. Like, the good things happen if I do the the things I'm supposed to do in
Yeah.
recovery. So that self-assessment, though, on Seeking Integrity homepage, you'll see both of those, and that could be a good place to start with that. Okay, so the next one, Dr. David, I am a betrayed partner. We are pre-disclosure, 2 decades together. First major betrayal discovery 10 years ago. Second major betrayal discovery 9 months ago. He just started with a CSAT. He has been in EMDR treatment for a few months now. He seems to have forgotten so much, and to be honest, I'm starting to believe he is just lying or living in denial still. I was so mad last night and asked him if he remembers anything about our teenage or his childhood, because it seems he can't remember anything that he did during that time period. He didn't answer and got upset with me for asking that. I genuinely wanted to know, because the type of memory loss is concerning to me as a spouse.
Again, there's so many kind of factors here. Denial, as I said a couple minutes ago, the addict can fool themselves as well. And I think a lot of times we um, aren't accurately recording in our memories a lot of what happens, or don't want to really think about it too much. We kind of set it aside, or we're preoccupied and we're not really paying attention, and those memories get kind of loose. So I think there's a lot of factors going on. It's hard to say, to what level denial still is existing there. The EMDR, I think, is useful because that also kind of helps go back and consolidate memories and bring others to light, and kind of people can often get more of an accurate reading on what might have happened than their current memory state would inform them. So we can kind of get sort of sometimes a more realistic view of what actually happened than our memory of it would indicate. So the EMDR work, I think, is going to be very beneficial. That's a long process you've been in. Obviously, must be very discouraging. I'm not sure the ages, but I think sometimes that can also be a factor. We start to worry about memory. There's other, independent of addiction, there's other concerns sometimes. But I think with addiction itself, it does impact people's recollection of stuff. A lot of times there's been such an active compartmentalization of life incidents. So I have my public life, and I have my secret life, and then I have my other secret life, all that. And when we live so divided and compartmentalized like that over years and decades, that does affect also memories and our perception of things and how things fit together. So yeah, I think maybe time will tell. But I would express your concern. I would, if you feel comfortable doing that. I think these memory issues are something that's really useful to talk about with the CSAT. And talk about, because that person knows the client better than anybody else and can have a better opinion on it, because there's so many different factors going on there. But I think it's not unusual to see some of the very different memories. I'll use it just to take it out of the addiction world. So think about siblings sometimes. When we look back on our childhood experiences, it's like my sister and I sometimes compare notes, and it's like we grew up in two different households, right? And so, and then that very much skewed by our own personal experience and colored by our own emotions, and but it can seem very different. I think there's a little bit of a parallel here with that kind of very different experience, or the level of engagement in the experience at the time can impact how the level of detail people remember, and so on. So it's definitely worth talking about, though, because I think that can actually be a point of healing in a relationship, to talk about those things, and maybe the discrepancies with them. That might be a useful therapeutic approach sometimes.
Yeah, and there's so much here. I think it's a great question. And so first of all, I want to start out like, I hope you're doing the betrayed partner work group that starts, if you haven't already done one, we have that starting again June 23rd, I think. It's a Sunday. It's the first time Angela's offered it on a Sunday, and it'll be useful tools, but it's also support. So I'm thrilled you're here. But we talk about healthy boundaries, all of those things. As far as the timing thing, like I have so many thoughts on this, but like Scott has talked about, like being in the bubble and you don't remember, and I see that all the time with addicts. And even if you're doing formal therapeutic disclosure, there is, for the people that are, the professionals, like there's a plan for if something else is remembered, because, even if they're doing a really great job and doing the, timeline, something else could pop into your brain. Addiction is so compartmentalized. So I could absolutely see it being like, like you said, there's a secret life, part one and part two, and then there's my, my public facing, and there's my family, like all of these compartments. And with a discovery, all of those compartments, leaked, and now it's a mess. And so it's challenging. And yes, could there be, some cognitive, disorder? My big thing is, though, I don't know if this is true, but you're saying he's just starting to see a CSAT and doing EMDR. I don't hear. He's doing 90 meetings in 90 days with 12-step. He's got a sponsor. He's doing the steps. I don't hear real recovery work. Like if he was seeing Dr. David, brilliant therapist, and that would so not be enough. We've both talked about how we continue our recovery process. This is a 24/7. You guys have been dealing with this forever. He's been dealing with it probably since before age 10, but you've had, two, massive discoveries, and probably, unfortunately, we're thinking, oh, things are, doing pretty good, and then had this whole thing blow up on you again. So I'm in this would not be enough, and I would not feel safe. And so you can have conversations with him, but I don't expect him to be able, at this point, to be able to be truthful with himself, let alone you. And so my biggest point is, I hope you're getting help to take care of you. And if what you're sharing is all, it's not enough. And from my experience of addressing the issues, it's just not enough. Like, we need way more help than that would offer. So
It's a really good point, Tammy. It's just that one kind of specialized trauma therapy is not going to carry the ball. It needs a lot of work for both parties, and a lot of support.
Oh yeah, she adds, thank you. I feel like it's taking so long for him to even remember the things he needs to do for a real, honest, full disclosure. I'm 33 and he's 35. I'm so tired and wondering what my life is. So again, please lean into the support for you. I feel like he did his best to forget all of this because he never intended to tell me. Yes. Yes. And he's in 12-step, but he has no sponsor yet. I've been telling him the same thing, Tammy. Thank you. Yeah. I thought he was recovered. I knew nothing about SAPA or betrayal trauma 9 months ago. So, and here's the deal. Nothing you did or didn't do caused this. Nothing you do or don't do is going to change that, except when addicts start bumping up against partners. Hey, healthy boundaries are not about control or punishment. It's about, I hear you're exhausted. Like I hear the hurt and the pain. So you taking care of you are the only person that can take care of you. He hasn't even taken care of himself yet. So, he can't take care of you, but you getting healthy boundaries, then all of a sudden, addicts are going, oh, wait, something shifted here, and not always, but sometimes it's like, oh, wait, I need to do, oh, wait, Dr. Rob does a lot of this, come here, go away, come here, go away. And so if the status quo is you're still there, and even, and it's with all due respect and love, I'm saying, you're suggesting things to him for his recovery. Like, I think it's fair for you, like Dr. David said, to talk about, talk with the CSAT. Here's some issues I'm seeing. Here's what I don't see, progress of this. And Dr. David talked about the elevator. My analogy with the 12 steps is the elevator to recovery is broken. Please use the steps. And we have to work the steps. I love meetings and I go, but it's also using the steps. We get freedom from our problematic behaviors in steps 4 through 9. Scott and I did a webinar earlier this year on the 12 steps, because I just think it's a really misunderstood and different, like, with alcohol, it's AA, easy, go to AA, with the S groups, there's, a whole bunch of different ones. And how do I know if SPAA, SCA, SAA, how do I know? Well, we did kind of, an overview of all of that. So, like there's opportunities. We had the Sex Addiction 101 online work group start on Monday. This is Wednesday. He could still join that if he hasn't. Like that's the 3-circle plan that Dr. David was talking about. Guess what? Guys have a 3-circle plan, when they, get done with that. And then they also have connection with other people who are doing a 3-circle plan. So it's good stuff. I'm done. I will stop my rant.
It's good stuff.
Yeah. It's just like, here's one more, in the big book of the 12-step big book, it's half measures availed us nothing. We stood at the turning point. We have to make a choice. I often say it's a picket fence you're straddling. You're not really in, it's a horrible place to be, is not really in the acting out, because there's all the dopamine and all the intensity, and not really in recovery using the tools that we are given. So you're kind of stuck, and it's not a great place to be. And so at some point, we stood at the turning point. We have to make a decision. But for partners, like, please choose you. Please choose, the support that you need to take care of you. You've got, you clearly have kiddos, or at least one, because so, like, you modeling good boundaries for you, and what you need to take care of you is powerful for you and children too. Okay, let's see. Oh no, don't stop. Don't encourage me. Okay. Can you give an example for a boundary for when the addict tells white lies? There's no such thing as a white lie that the betrayed partner themselves might even tell. I don't care if it doesn't affect his sobriety or my safety, but I'm tired of holding a strong no tolerance boundary for what seems like human behavior. He seems to be in good recovery for a year and doing all the things, but lies occasionally about stuff I don't care about. But then I let it slide. What will slide next? That's exactly right. So we're seeking integrity. So integrity is hugely important to me. Like lies of omission, lies of commission, it just doesn't cut it. So my level of serenity, my level of recovery is, that would be an indicator. If I start lying about irrelevance, first of all, if it's irrelevant, why would I need to lie? There's no need to lie. So for me, and this is just me, but I need to be truthful. If somebody asks me something, like, they know, don't ask unless they're willing to hear. I want to be kind about things, but I'm not going to say, oh yeah, that dress looks great on you, when it doesn't. Now, I probably would say, I think there might be a better choice. I would be kind about how I say it, but yeah, don't ask me a question if you're looking for me to, to give a misstatement or a mistruth. So to me, like, I don't believe in white lies. What are your thoughts, Dr. David?
Yes, same thing. The example you hear about sometimes is you know, a couple finishing up after dinner, and the wife asks her husband, the recovering sex addict, did you take the garbage out? Yes, I did. But he hadn't, right? And then 10 minutes later, out the kitchen window, she sees him sneaking the can out to the street. I mean, that could be, I guess, a white lie, but what does that do? It undermines the trust. It undermines the integrity. And then there you exactly named it. The question of, okay, well, if you lie about that, what else is going on? It sets a trend, and I think that ability to really live in integrity has to mean that we are, honest in all our affairs, and even down to this what could be the silly stuff, maybe in ordinary circumstances, but it comes down to integrity and my word. And yeah, what's the big deal? Like, I didn't take out the garbage. It means owning. And I've been, as a therapist, what I want to do, I want to pull on that string, because that gets into shame and deceit, and it gets into all kinds of other stuff. And why would you lie? Well, old patterns, giving an impression of progress. I mean, there's a lot of stuff there to look at. So I agree to Tim. There's no room for that. And other people that maybe don't have an addiction or a recovery process underway maybe have the luxury of white lies, but I think they're really slippery slopes for an addict in recovery and everybody around them. So I kind of have a pretty firm line on that myself.
Yeah, and even for a partner, I'm like you said, there's a benefit to it. Like, oh, I don't want to get in trouble. I didn't take out the trash. I can quick sneak it out. Well, like, how much better to go? No, look, I know you asked me. I did not take that out. I'm sorry. No excuses. I'm going to go do that now. Okay. Easy. So yeah, I think that there's a benefit to it. Like, I don't want to hurt somebody's feelings. I don't want to deal with something, whatever it is, there's some secondary benefit achieved by lying. And I would invite you as a partner to go like, I think it would be interesting for you to go, what am I getting out of lying? And is that the person I want to be? And again, you get to choose it. Like, truly, no judgment. But like, if you want a relationship with your partner and you want it to be honest, then like, to me, that would be both of you being willing to step into that scary space of, we're going to be truthful. And if lies are part of the fabric, it may be uncomfortable and you probably won't do it well initially, but gosh, you guys could have a relationship that is built on honesty. You have a solid foundation, not one that's built on, sand. So
we spoke earlier of intimacy, right? I think everybody in recovery is going for intimacy in their relationships. And one of the elements of intimacy is the ability to be vulnerable. And being vulnerable may mean, okay, sorry, I didn't. I'm embarrassed about it. I meant to, whatever. But at least we're having a real conversation now. And that even that little over something silly or stupid, but that can be we can turn it into a growing opportunity, because we're having a real conversation. And then we can go, well, why did I say that? Or why was I reluctant? And that leads down a whole other way that can really be a growth opportunity as well. So it's that vulnerability with each other. And I think when we do those white lies, we're scooting over that in a way that's not very helpful.
And I think that could be a great point of connection for the two of you to go, we both have this pattern, and this is something that, we, will, for the betterment of our relationship, I'd like to work on making progress in this. And so, like, we talk about the 24-hour rule. Well, like, that can go both ways, that we go, hey, when I said that, it wasn't the full truth. It can even be the lies of omission, where I didn't tell the whole truth, but how do you both have this pattern? And I'm to me, that's, if both of you are struggling with, being truth tellers, and this isn't about being harsh, it's just about being accountable. Thoughts?
Totally. I think when we, yeah, I think when we're, I remember once someone once said, when we're nice, it's dishonest, and sometimes because we're really paying more, we're giving more priority to the feelings and protecting maybe from feelings, or as opposed to sort of explaining how we really feel. And I think that just becomes noise in the communication, white noise that's not helpful. And so, like, just to really be able to be truthful about that and to say what we need and say what we want and say what we mean. And I think a lot of times that gets in the way of really an effective relationship. So I think, and that may need, and for those of us that maybe not are used to doing that all the time, we may not know what we want, right? That's the classic pattern of a lot of addicts. It's like once they get sober, they've been driven so long by the compulsivity, they don't really know what they want. So part of that's a discovery process as well. But, and that, I think that probably goes through all our partners as well. But it's a matter of the communication, the dialogue that really builds the recovery work and the intimacy piece that has great payoff when we can do it.
Well, and she added, the withholding as a betrayed partner, I have problems being vulnerable with him because he used it against me previously. I can understand there would be fear. And you know what, like even prefacing this with, I'm going to be honest with you, and I'm scared because you've used this against me. So, but I'm going to be willing to step into that vulnerable space. Anytime I have a conversation, like Dr. David, I need to have a difficult conversation with you, and I've got some fear around this. Immediately, it takes some of the energy around. Now, I don't know what he's going to do with it, but like for you to just be willing to step into that space, I bet you will feel better about yourself, just like, yeah. So screaming my pain at him is easy, crying my truth with him is hard. Yeah. This would be couples, like that sounds like a point where having a couples therapist help you guys navigate, even the fair fighting and everything. And I see another question coming in, and I'm sorry we're out of time. So bring it back. So, or do you have another minute? Do you need to go real quick?
I'm okay. Yeah. No,
okay. All right. Last question. Okay, my SA husband has been in good recovery for 6 months, CSAT group, 12-step group, sponsor, couples therapy. He has developed empathy for the first time in his life and has felt good in experiencing connection with people for the first time. He has drinks with his coworkers every Friday night and sometimes has more than he should because he is a people pleaser. And if anyone's having another round, he'll usually say yes. On one hand, I am glad that he is building these relationships and that he is doing well in recovery. So I don't want him to take away his joy from him. Is it my job, though, to ask him to put boundaries around his drinking? I'm also a little triggered because Friday night drinks usually preceded his acting out in the past. Great question.
Yeah. So that last piece you just said, right, puts a color on this thing, that often preceded his acting out. So there's a pattern, a risky pattern. I always am concerned about somebody kind of moving into another addictive behavior as a kind of a substitute. I think from your point of view, what it would be totally legitimate to do is to express your concern that this is the pattern that's happened in the past when you had drinks on this time, Friday night. And I understand this is a social, way to bond with folks. But I have concern that the drinking part may be coloring it and may be a dangerous precedent to set. And whether he feels that way or not, that's your concern based on some reality, I think. And it's a totally legitimate point of view. I think, and you can also throw in, I also recognize this bonding time and don't want to interfere with that as you're kind of building these relationships or repairing these relationships. But what I wouldn't want you to do is minimize your own feelings about this, and there's some legitimate concern there, and I think that needs to be aired and talked about at some point.
I can only imagine, like, I have this vision of you sitting there on Friday night, fearful, and I think that it is definitely fair for you to share, that I'm concerned. And there's so many things, like, one of my addictions is drinking. You know what? If I was sitting there, which less likely to happen, but if I was, guess what? I'd be having soda or seltzer water or something. Like, like there's so many uh, cheats, so to speak, for that. There, it doesn't have to be an alcoholic drink. He doesn't have to have any alcohol, and he could still, be with coworkers. So I'm with Dr. David. Anything that you're going, well, I'm using something else, and alcohol is, a precursor too often to making a really poor choice. And while he can be doing good with recovery, one one vulnerable moment, and something could slip away, which I'm not trying to instill fear with you. You've got enough. But I think it's really fair for you to go, this causes me fear. I'm really grateful that you're connecting and you're showing empathy and all of those things. And, both are true, and so, and I love it when couples problem solve. So how can we come up with is there a way we
Mhm.
can problem solve this together so that you can go out, but I won't have to be fearful. And if he goes, oh, you don't need to worry about that then worry. But like, if he's going, like, I hear your legitimate concern, and yes, I could have a seltzer water, I could, I can do something differently, so there are options with this, but you holding that, in fear, isn't, to me, isn't fair for you. So
And this might be a really nice circumstance if there's a couples counselor there, or one of your therapists that could see the two of you on a one-time basis together. This could often, having a third party in that conversation is often very helpful, to kind of point out and keep it moving along and to keep it fair and balanced. Might be useful to incorporate a third person in that conversation.
yeah, because I don't hear you trying to control it. You've got a legitimate
Yeah.
concern. And I'm thinking, if he's had too much to drink, guess what? If he's driving home, he can end up with a DUI, and I mean, like, lots of negative consequences, for those things. So I think it's fair to have it be, can we have a conversation about this? So I mean, so that he can go meet with his coworkers, but it will also feel like a safer thing for you too. So. Great question. Thank you all for the questions. Dr. David will be back in 2 months, on the 2nd. He and Scott traded, due to scheduling for today. So, but thank you all. The recording will be posted on our website. As always, you can reach out to either of us, David at seekingintegrity.com, or me, Tammy, TAMI, at seekingintegrity.com, with questions. So thank you.
Great.
Bye.
Thanks, Tammy. Bye-bye.